Absolutely. So we were just talking about like this sort of exponential problem that the Black community faces regarding healthcare, but you can even expand on that more regarding what it's like for Black women dealing in a white healthcare system. What is wrong with that? Tell us what's wrong with that.
Oh gosh, that's a huge question.
All right, to understand, find a small part that you like.
Sure. So to understand health disparities and systemic racism, we have to really look at the root causes. And it has a lot to do with how people access healthcare, the medical industrial complex, and how it has been turned into a largely for-profit system, how Black people have been denied bodily autonomy, particularly Black women, since the beginning of this country, not having control over our own reproduction, our own sexuality, and how that translates into the healthcare system. Specifically as it relates to birthing, most people of all races were having their babies in their homes, what we call community-based birth, up until 100 years ago. And most people in the South were attended by Black midwives most people of all races. And birth was moved into hospitals by white doctors, really in this tradition of J. Marion Sims and other white male doctors who experimented on the bodies of Black women in very brutal ways. And then that, really became the foundation of what we know today as obstetrics. And so violence was a part of obstetrics from the beginning. And as birth moved into hospitals, the rights that people had within their own homes also went to the wayside, and Black midwives were pushed out, eradicated from the healthcare system, and birth became more of an industry than a family-centered event. And so with that, we started to see the rise of health disparities, of infant mortality, of maternal mortality, and people just really not having the right to access the care that they need and deserve. And that's the situation that we find ourselves in today, where birthing people are, told that they don't have the right to decide what their care looks like, where they can give birth, what type of providers, and are really not even educated about what their options are, what their rights are. And so, I've been working for the last 10, 12 years on the movement for birth justice, where, we're really seeking to restore both midwives and doulas as the central care providers in communities of color that really need us the most, and also to compel hospital systems to transform their policies to center around people's rights. And once we see, the return of bodily autonomy to birthing, the return of, a human rights-centered healthcare system where there is access, where there is dignity, where there is respect, and where there is autonomous decision-making, I believe that that's when we'll begin to see the shift in these statistics that are so horrifying, such as, Black women dying at 3 to 4 times the rate as their white counterparts.
Yeah. So one thing I did get from, and I had mentioned, Jamara, to Victoria, that, I'm new to the party. I get that. And I read Medical Apartheid. It freaked me out. Nothing that was surprising, but just, I guess, seeing it all compiled like that, like just all there, was just really, it was scary, actually. And what I did, one of the things I learned is that a lot of the things that were attributed as, Black diseases or Black health issues were not legitimate. But yet I also know that there are certain things that are legitimate in terms of, and I know, I don't want to make it be things that are not real. Like, I know the sickle cell thing is not necessarily real. Like, there's a lot of things that have been blown out of proportion. But can you, either of you, talk about what might be differences that are legitimate that need to be addressed in healthcare that are not being addressed?
I feel like the main issue that needs to be addressed is legitimate, is that Black people, Black patients, especially Black females, are patients, they're people, and they deserve to be heard and listened to. And you talk about some of the things that were brought up in the past, but even today, there's a group of physicians and healthcare providers who are fighting the racist myths that we hold now. Not only that Black women experience less pain, but there's something GFR. It's a measure of how your kidneys function, and just the myth that if you're Black, your GFR, if you go to most labs, you'll get a GFR number, and it'll say one number, and then it'll say another one for African Americans. And that African American number is larger, but African Americans are like 3 times more likely to end up on dialysis than Caucasians. But we have this myth that Black people, their GFR is higher than if they were exactly the same person, but they were white. So it makes us harder to get the help that we need when our kidneys are failing, because they're saying, oh, because of these old racist, way we make this, because your Black kidneys aren't failing as much, and eligible for disability, you're not eligible for Medicare, right? Because if your kidneys fail and you get up on dialysis, you can get a Medicare because you're Black and your number is a certain number. Whereas if you were exact same person but white, you would be eligible for. Not only that, our lung capacity, believing that Black people have diminished lung capacity. So it's not just things that happened in the past that we believed in. It's things that are still being taught in medical schools today, things that are still being believed today. I'm very passionate about advocating for all my patients, but especially my patients of color. And I tell them when they go to the ER, if they don't believe you, especially with pain, if you don't feel like, they're taking your complaint serious, call me, because I will make sure that they do. I recently had a gentleman who went to the ER for a pain complaint, and I got a call from the ER, he's here with pain. We're going to let him go to follow up with you. And the way they describe the pain and the way they describe the imaging studies, I was like, wait a minute. This sounds like it needs to be an admission. Can the patient walk? No, they're really having a lot of difficulty walking. So you're sending somebody home with severe findings that correlate with their pain. So they're not making the pain, because the pain is consistent with the abnormality that you saw in their imaging. They can't walk, and you're thinking about sending them home. I said, are you sending them home because they're Black? Because I'm a Black physician and I'm very passionate about health disparities, and non-Black providers hold these implicit biases when Black patients come in with pain complaints. Fast forward, some of the patients now getting admitted because I had that conversation with them. So I have a question. I hope I didn't go too far off topic.
No, it's true. I think that it is.
It's missing.
See, she's breaking up, but I don't think it's us. Is it us?
No, I think.
Are you there, Victoria?
Victoria, can you hear us? Our signal seems fine.
Jamara, you can hear us, right?
Yes.
Okay, so it's not us. I think you broke up a little bit, but that is something that I've seen, not with a Black woman, but a friend of mine. Actually, this gentleman here who died a few years ago is a very good friend of mine. And he went into the emergency room. He knew that he was having a stroke. He knew he was having a stroke. Like, he knew the symptoms. He went in there, told them that he knew he was having a stroke, and yet it took them an additional 6 hours to officially diagnose him with a stroke. Meanwhile, then the next day after they did, they sent him home, where he fell and ended up back in the emergency room. And I've always questioned whether or not that would have happened to a white man. I don't think that would have happened to a white man. And that has just stuck with me. They completely discounted what he was saying. And he knew what he was talking about because he had a Bell's palsy situation. And so he had actually done all this research on strokes. So he actually knew that, and yet nothing. And whether or not he would still be alive, I don't know, but I know they didn't treat him right. And that is something that I will never forget. So this is another reason why I wanted to really have this. Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.